maybe we should just take this opportunity to just explain a little bit about the BRAF, right? Because one of the treatment, the targeted therapy, the BRAF inhibitors, and is sort of targeting against that somatic mutation, and sort of And this is,
and it's really it's very important because it's a very unusual mutation, the BRAF mutation, because it's so common. And in fact, it's present. That mutation is one of the ones that we think may be the first one that sort of happens before you get the other mutations that ultimately cause cancer. And so it's present in about 50 to 60% of just plain moles.
yeah,
The BRAF mutation can be in just a plain mole, and then you get another mutation on top of it, right? And that takes it closer to a cancer, and then another mutation takes it closer. But what's cool about it, because it's so common, it's present so commonly, and it's a single mutation. So what they did is created a drug, right? A drug that specifically knocks out the cells, only the cells that have a BRAF with that mutation in it, right? So that's why they call it targeted therapy, right? Because it targets that little mutation that is in the bad cells, but not in the good cells. So the BRAF, but the problem is that the cancer cells are smart too, right? And they can evade the BRAF, but it turns out that if you do a BRAF plus a MEK inhibitor at the same time, right? Then you keep it from bypassing, and it's sort of out tricking the trickster, the cancer trickster, right? And you're able to keep a lot of people from having further spread of their melanoma just by treating with those two drugs that are targeting those bad cells that have that mutation in them.
I think you touched upon two very important points, right? I mean, I think one is just remarkable to think that, because the BRAF mutation associated with melanoma, just on the 600th position, you have one amino acid change and somehow just drive that clone of cells just progressing, right? And that's why if you target that specifically, you can shut that process down. Another thing, like I think you touched upon a little bit, and I just want to explain a little bit for the public out there, is that people think melanoma is just one type of cells, but in reality, within that melanoma, you have different clones, perhaps, right? So especially for metastatic disease, so you may go after that clone and knock it out, but then you've self-selected another set of clones, and now they can sort of grow and proliferate. So those are really great, and